Good afternoon, this is Susan Schramm, the Hospice Ancillary Services Supervisor, and today we are studying Understanding Fall Risk Factors. And we'll go ahead, I've marked certain parts of the catalog, the booklet that we'll be going through to touch key points. Obviously, we're not going to be able to get to everything today, but you will be able to read it on your own to be able to get the entire program. I'll go ahead and start reading. So on page 1, everyone loved Big Jim. The staff at the Sunset Hills Rest Home loved Mr. Sanders. He told everyone to call him Big Jim. That had been his nickname since high school. Big Jim was kind and funny. Unfortunately, he had many health problems, and he had often felt bad that the nursing assistants had to work so hard to care for him. Big Jim suffered from diabetes, high blood pressure, and kidney failure. He used a walker to get around his room, but needed a wheelchair to go any farther. He was weak and unsteady on his feet and often got dizzy when moving from sitting to standing. Of course, the nursing assistants didn't mind caring for Big Jim at all, and since he was so much fun to talk to, no one ever complained about how hard it was to help a man as big as Big Jim. One day, Big Jim was sitting in his reclining chair eating lunch and was watching the noon news. He felt a little tired when he finished and wanted to go back to bed. He knew he had to call the nursing assistant for help. They had told him many times, "Don't try to go back to bed yourself. Call us and we'll gladly come help you." And they always did. But on this day, Big Jim called and no one came. After about 5 minutes, he decided to try to get back into bed himself. He had his walker and it wasn't very far. When Big Jim stood up, the room began to spin. His knees and elbows felt wobbly, and then everything went dark, and he hit the floor. Everyone heard the crash and came running. Big Jim was rushed off to the ER, but on his way to the hospital, Big Jim died. He had hit his head on the foot of the bed when he fell. 1 out of 3 adults ages 65 and older falls each year, and falls are leading cause of death in this age group. The hardest part of the job may be maintaining your client's safety. Knowing all you can know about why people fall is the first step. Keep reading to find out more about falls. We go to page 2, under Fall Risk Assessment. Federal law requires all healthcare providers to assess each client's risk for falls within the first 14 days of admission, and to reassess periodically throughout the duration of care as a client's condition changes. It's a good idea to know who is responsible for doing clients' fall assessments, and you should take time to find out your client's fall risk levels so you can take the proper precautions. Be sure to report any changes in status to the nurse so the fall risk can be adjusted. If you go on page 3, we'll go ahead and read the top. Focus age-related risk factors. As the body changes with age, such as poor vision, loss of muscle strength, and joint stiffness, make elderly people more likely to fall. Here are some additional details about age-related fall risk factors. Muscle strength decreases gradually with age. Joint tendons, ligaments lose their flexibility and limit motion. For example, lack of muscle and reduced range of motion can cause low foot swing, which might cause your clients to trip over their own feet. Regular exercise is a key to help your clients remain as independent as possible. Reflexes begin to slow as a person ages, making it hard for them to react quickly and catch their balance. Vision diminishes with advancing age, and this directly affects the sensory systems involved with movement. Depth perception is an important part of vision, and it allows a client to tell how far away certain objects are. As a client's vision worsens, so does their depth perception, and making it hard to judge distance and easily causing a fall. Some people begin to lose their hearing as they get older. If your client doesn't hear well, he may not be aware of obstacles or other people in his path. In addition, with ears containing sensory cells, that affects the ability to balance. With age, these cells gradually decrease and cannot be replaced. This means that the older people may have a problem keeping their balance. As people age, changing in sleep patterns are very common. Many seniors have trouble falling asleep and often wake up after only a few hours. Falls can't occur during a restless night, especially in a dark room. And daytime fatigue may be so overwhelming that they have trouble participating in normal activities. If your client fails to get a good night's sleep, they may be prone to falling during the daytime. Page 4. Medical-related risk factors. Many diseases and disorders such as Parkinson's disease and arthritis put patients at risk for falls. Clients who take several different medications are also at risk. Side effects of some medications may include dizziness, confusion, and/or drowsiness, which could all contribute to a fall. Arthritis can cause permanent crippling, non-reversible effects and put a person at high risk for a fall. In addition, some injuries to the knees, hips, back do not heal completely, causing limited range of motion. Osteoporosis is a condition that causes bones to become weak and brittle. Elderly women at risk for osteoporosis might even a slight fall can cause severely broken bones. Recent studies have shown that taking vitamin D daily may help with this problem. Sore feet. From foot disorders such as nail problems, corns, blisters, heel pain can cause falls. Some of your clients may experience a drop in blood pressure upon standing. This is called orthostatic hypotension and can be caused by a number of conditions, including diabetes and Parkinson's disease, heart failure, dehydration, infection, and a number of medications such as diuretics, blood pressure medications. The sudden drop in blood pressure can cause dizziness, leading to a fall. The side effects of medication can upset balance and cause a fall. Medications for depression, sleep problems, and high blood pressure can cause falls. Some medications for diabetes and heart conditions, can also affect a person's balance. People who take 4 or more medications are at high risk for falling, especially if their medications have changed in the past 2 weeks. Incontinence or trouble controlling the bladder or bowels can increase the chances for falls. Your client could easily trip or stumble on something as he hurries to the bathroom. Being mentally or cognitively impaired puts a person at high risk for falls, and this includes people diagnosed with mental retardation, autism, or dementia. Okay, we're going to go over to page 5, second paragraph down, which is some frightening statistics about falls in nursing homes. This is scary. While half of all falls happen in private homes, some recent studies show that high risk for falls among nursing home residents. Every year there are from 100 to 200 reported falls in a typical 100-bed nursing home. As many as 75% of all nursing home residents fall down every year. Many people who live in nursing homes experience 2 or more falls per year. Each year, about 1,800 residents die as a result from falling down. Remember that people who live in nursing homes are generally more frail than seniors who live out in the community. They tend to be older and more chronic illnesses, including dementia, and are often physically dependent. Due to their serious risk factors, they represent a special challenge when it comes to prevention. All over America, nursing assistants and their coworkers are doing the best to reduce these alarming statistics. So on the right-hand side, under Trying This Now, apply what you've learned. It's the Get Up and Go test. So it's a simple test that makes it easy to tell if a client is steady on his or her feet. The first step, number one, is the first step is to have your client sit in the chair with a upright back. Next, ask your client to stand. Allow them to use the armrest to push himself up unless absolutely necessary. Sorry, that was don't allow them. Number three is ask your client to stay standing once he's up. If you notice him swaying or hesitating, then he is probably at a risk for a fall. Next, ask the person to walk about 10 feet, turn around and walk back and sit down. Again, if you see them swaying before you ask them to walk, then don't have them go any further because you already know that they're going to be at a risk for a fall and you don't want that. And clues that the client has trouble with this test may include the following: hesitating, stumbling, taking small steps, moving slowly, or asking for help. And if your client exhibits any of these risk factors, you should report and document your findings. Okay. Under page 6, we're going to go about halfway down the page. You can read the other stuff. I'm going to go down to assistive equipment cannot help prevent falls if it is not in good working condition. Here's what you should look for. So when you're in a patient's home or a facility, you're going to want to make sure that you're looking at these wheelchairs and walkers or cane to make sure that they're steady, that their brakes work, those kinds of things. We may think the other person is looking, and you may be the only one that's looking at these things. So we want to make sure we keep our patients safe. So check canes. If the cane is made of wood, inspect the shaft and handle for cracks, splintering, or weak spots. If the cane is metal, check for all bolts and screws that are present, making the cane stable and strong. Check if the rubber tip is present and inspect the shape, which should be even and clean. Check walkers. Look at the bolts and screws to see if all connections are present and secure. Check for all 4 of the rubber tips and inspect their shape, which should be even and clean. If the walker has caster wheels, make sure they are firm and in good shape and roll smoothly. Check wheelchairs. Make sure all bolts and screws are present and secure. Check wheels. The wheels should be firm, smooth, roll straight without wobbling. Brakes should be firm, engaged, and should stop the wheelchair from moving at all. Check the seat, the backrest for tears and rips and weak spots. Make sure that the foot and legs move easily and sit firmly in the proper position for your client. If you discover faulty equipment, follow your workplace guidelines for reporting and requesting repairs. Never attempt to repair equipment yourself. Assistive equipment should only be reassembled and installed and repaired by a trained professional. Okay, we're going to go to page 7. Under client and family education, many agencies and facilities have a way of identifying clients who are at high risk for falls. Your workplace may use brightly colored wristbands, place a star over the door to indicate a falling star, or place a sticker on the chart to identify those clients who are most likely to fall. Excuse me. It's after lunch and I'm tired. Be sure you know your workplace system for identifying clients at high risk for falls and make sure that you are clear about what it means. Talk to your client about the risk for falls. Clients who are not confused or disoriented can and should be trusted to work with the healthcare team to make themselves safe. Confused or non-compliant or combative clients may need to be coaxed into following the rules to keep them safe. For example, you may need to sit down with your client and the family members and convince the client to agree to call for help as needed, or you may even have them sign a contract. The contract may simply be a piece of paper that says, "I will call for help before I get up and walk." Then you have the client sign it and tape it where they can see it. Page 8. Tips for preventing falls. I'm going to read a few to you. I'm not going to read the whole list, but I'll read a few and then you can read the rest on your own. When you begin caring for a new client, ask your supervisor about the fall risk level, and if the risk assessment has not been done yet, use the standard fall precautions. And this goes for, instead of coming and talking to your supervisor, you can talk with the case manager who may know the patient a little bit better, or even the social worker. Encourage your client to stay as active as possible to get some kind of daily exercise. If your client has been treated by a physical therapist, ask the physical therapist what you can do to help your client stay active. Report any changes in memory or hearing to your supervisor. In this case, you would report it to the case manager. For clients with a history of dizziness, encourage them to sit on the side of the bed for a few minutes before attempting to stand. That's really important. That's where the orthostatic hypotension comes in, when you jump up after not sitting there for a little bit. If your client uses a hospital bed, make sure they are secured at the lowest position and use the side rails safely as ordered. If your facility uses a bed or chair alarms to help prevent falls, be sure that your client understands how they work. And this is good for when you're in a facility. You want to make sure that if you're giving showers to a patient in a facility, that you return the patient to where they were. So if they were laying in the bed with a bed alarm on, make sure you reapply that bed alarm. Or if they're in the wheelchair, you got them out, gave them a shower, put them back in the wheelchair, and if there was a bed alarm, reattach it. We want to make sure we catch patients before they fall, and that bed alarm and chair alarm are going to come in handy. On page 9, we're almost done. On the right-hand side, under 5 key points, I'll read a few. Key points to remember. 1 out of 3 adults aged 65 and older falls each year, and falls are the leading cause of death in this age group. Federal law requires all healthcare providers to assess each client's falls within the first 14 days of admission, and to reassess periodically throughout the duration of care as a client's condition changes. It's important to report any changes to your client's physical, mental, emotional status. Even small changes could trigger the need for your supervisor to reevaluate a client's risk for falling. So now we're going to go ahead and take the test. I'll go ahead and get the questions ready. Okay, number 1. Which of the following is not a risk factor for falls? Confusion, poor vision, poor upper body strength, or taking 3 or more medications? The answer to that one is poor upper body strength. While upper body strength may be needed to help a person come to a standing position, it does not contribute to fall risk. Confusion, poor vision, and taking 3 or more medications all place a client at a greater risk for falls. Number 2, which of the following clients is most at risk for a fall? Would it be an independent 72-year-old woman who lives alone, a 68-year-old man with Parkinson's who lives in a nursing home, a 62-year-old woman who walks every day after suffering a hip fracture, or a blind but otherwise healthy 76-year-old who lives at home with his wife? Which one do you think? Let's say B, a 68-year-old man with Parkinson's who lives in a nursing home. This client has the most risk for falls, risk factors associated with falls. He is over 65, he lives in a nursing home, and he has Parkinson's, which usually is causes a problem with gait and coordination. Okay, number 3. Poor sleep can place a client at risk for falls when A, the lack of sleep causes fatigue, confusion, and agitation. Daytime fatigue limits participation in normal activities. C, restlessness leads to getting out of bed at night, especially in the dark. Or D, all of the above. And the answer is D, all of the above. Lack of sleep causes fatigue, confusion, or agitation, limits participation in normal activities, and can lead to restlessness or getting out of bed at night, especially in the dark, all of which contribute to the greater risk for falling. Number 4, a good way to keep elderly clients safe from falls is to A, use restraints, B, encourage daily exercise, C, increase staff, or D, limit trips to the bathroom? All right, did you read it? Number 4 is B, encourage daily exercise. Number 5 is true or false. If you discover your client's walker is broken, you should locate tools and fix it. And that answer is false. If you discover your client's walker is broken, you should report it, request a loaner or replacement, and send it for repairs if repair is possible. And number 6, true or false? Many people who live in nursing homes experience 2 or more falls per year. And the answer to number 6 is true. Many people who live in nursing homes experience 2 or more falls per year. People who live in nursing homes are generally older, more frail, and have a more chronic illness, including dementia, than seniors who live out in the community. This makes the risk for falls much greater in this population. Number 7, true or false? Clients who are not confused or disoriented can and should be trusted to work with healthcare team to keep themselves safe. And the answer is true. Clients who are not confused or disoriented can and should be trusted to work with healthcare team to keep themselves safe. Educate clients and their families about the workplace fall prevention program. Number 8, true or false? A fall risk assessment is not required, but most caregivers do it anyway as a courtesy to client. We know that's false. Federal law requires all healthcare providers to assess each client's risk for falls within the first 14 days of admission and to reassess periodically throughout the duration of care as the client's condition changes. Almost done. All right, number 9, true or false? The more risk factors as a client has, the greater the chance of falls. I'm going to say true. True. The more risk factors a client has, the greater the chance for falls. And number 10 is a fill in the blank. A simple test that makes it easy to tell if a client is steady on his or her feet is known as the get blank and blank test. Get up and go. So, up and go are the fill in the blank questions. I'll go through one more time and just reread the answers. Make sure we have everything that matches. Number 1 is C, 2 is B, 3 is D, 4 is B, 5 is false, 6 is true, 8 is true. Hold on. 5 is false, 6 is true, 7 is true, 8 is false, 9 is true, and 10 is up and go. All right. Thank you very much. I hope you enjoyed the video.
You're welcome.
Thank you.